Dear distinguished members of the committee, the chair, Estonia is not a country that openly propagates homophobia and transphobia, nor does it have any forms of penalties for exercising homosexual conduct. There is an evident systematic homophobia still present within the governmental apparatus, especially in the healthcare sector. Apart from that, men who have sex with men, being a population that has high HIV prevalence rates, we require open national support and protection in order to come out of the shadow and turn to healthcare to receive HIV prevention tools, get timely diagnosis and treatment. Despite Estonia taking the aforementioned obligations on, the present situation that has erupted to the MSM inclines that the country does not consider it necessary to ensure the right to health for everyone person in the good spirit and equality. In 2018, ЕКОМ, my organization, prepared 2 reviews regarding HIV among MSM in Estonia and found that there is barely any data or attention devoted to gay men and its health needs. Since sex between men accounted for the largest proportion of HIV cases diagnosed in 2016, which is 40%, MSM is a group that is at highest risk of new infection cases. It means that this population group requires special attention and effort to reduce the prevalence rate and exercise effective HIV prevention through sexual education, non-discriminatory health care, and elimination of stigma. Independent and governmental surveys specify that there are up to 9,000 homosexual and bisexual men in Estonia, but the number is definitely much larger since a significant proportion of MSM remain in the closet. That being said, Estonia's attention to another HIV group, people who inject drugs, at their right to health is more focused and supportive compared to the virtually absent attention to MSM. The MSM population is 9,000 people in Estonia, and people who inject drugs is governmentally estimated to be around 9,000 people as well. For example, Estonian National Health Plan Report 2015-16 includes HIV testing for risk groups, including people who inject drugs, and MSM are not officially stated as a risk group at all. There is no official mechanism that would allow the civil society to influence the allocation of funds for HIV programs and their distribution among the population. No non-governmental organization or other organization have any opportunity to file applications, pleas, or complaints about how the funds for HIV programs are distributed, because there is a void in Estonian legislation for these opportunities. As the current strategy for health of population has been drafted, no LGBT representatives have been invited to take part in this planning. LGBT organizations are not regularly consulted in policy making, which is especially true in the health sector, where the overall strategy makes no reference to LGBT persons. Apart from this, the mechanisms for assessing the effectiveness and efficiency of the governmental HIV programs is unclear. When such a program is adopted, the regulation does not explicitly state who is responsible for its realization. There is no monitoring and evaluation system for such programs. It becomes apparent that the right to health is not equally supported by the government for everybody. The MSM HIV needs do not receive the same attention, which results in the government violation of the right to health and infringing its obligation to ensure the highest attainable standard of health for all people equally and to endeavor to prevent, treat, and control all epidemics and for everyone fairly. With regard to the facts stipulated in the report based on the needs of MSM as people that possess the same equal rights as heterosexual people, and considering the indifferent discriminatory position of the government, the Eurasian Coalition on Male Health believes that in order for Estonia to be able to come closer to realization of its international obligation under ICCPR and ICCR has to make the protection of all people from being discriminated based on their sexual orientation universal and not only in the scope of labor relations. Create an official procedure that would allow the LGBT organization to legally assess and influence the planning and distribution of governmental budget funds allocated for HIV programs. Introduce a mandatory annual assessment mechanism that would evaluate the coverage and effectiveness of the governmentally maintained and supported HIV programs. Conduct a full-scale due diligence and assessment of the current HIV programs and redistribute the funds in such a manner that would be adequate for the needs of gay men. Outline men who have sex with men as separate key target population group with its own needs and peculiarities that which should be covered under a governmental HIV program separately. And the last but not least, create an official annual research framework that would oblige the government to study the LGBT in Estonia for there to be comprehensive, official, qualitative and quantitative data on this community. Thank you so much.